Following the ongoing campaign for vaccination against the COVID-19 pandemic in the country, the National Primary Healthcare Agency have been giving updates on the vaccination and its success stories so far. On this day, 1st June 2021, according to an address by Dr. Faisal Shuaibu, the Executive Director NPHCDA, during a joint press briefing on COVID-19 vaccination update in Nigeria, over 73,465 Nigerians have successfully taken the second dose of the Oxford AstraZeneca vaccines. These persons include the President Muhammadu Buhari, Vice President alongside other legislative members as well as religious leaders in the country. Further calling on all Nigerians who have previously taken the first dose should endeavor to take the second dose to ensure and guarantee complete effectiveness of the vaccine. According to him, several adverse effects from the vaccination ranging from light, moderate and severe symptoms, of which they have recovered from, stating that the vaccine is safe and effective for use. He also gave more insights on the efforts of stakeholders involved in the fight of the pandemic, applauding their efforts and urging Nigerians to remain vigilant and comply with the COVID-19 guidance to prevent the Indian Virant third wave of the pandemic in the country.
Continue to advise that all Nigerians who have received their first dose should check their vaccination cards for the dates of their second dose and proceed to the same health facility where they got their first jab to ensure full protection against COVID-19.
The representative of the World Health Organization, Dr. Walter Mulumbo, addressed the issue of African continent having limited access to the vaccine and how important the vaccines are to Nigerians, stating further that even with this challenge faced, Nigeria has stand out among many other countries with outstanding performance in terms of the administration of vaccine and also serve a prototype for other countries to emulate from.
Africa is lagging behind. But even though Africa is lagging behind, Nigeria is among the countries that has distributed the most COVID-19 vaccine as we speak. We know that in terms of volume, we are still a long way to go because we have a plan to vaccinate more than 100 million of our population, effectively roll out the COVID-19 vaccination, starting with the frontline workers and the elderly, people with underlying condition, and others. It has really been a great experience. As a matter of fact, in Africa, we are witnessing a kind of paradox. While on the one hand, the continent has received less of its share in terms of vaccine through the COVAX facility or other mechanism. At the same time, we have a number of African countries that are losing the vaccine because they expire before even they could be used. Some are redistributing the vaccine elsewhere. So it's kind of sending a contradictory message about the need for vaccine. We need those vaccines to end the acute phase of the pandemic.
The UNICEF country representative acknowledged the leadership of the Nigerian government and strong leadership of the NPHCDA partners and stakeholders over their tremendous efforts in the campaign and administration of the vaccine. On his final note, he called on federal health workers to get themselves vaccinated to help in the fight. Lastly, media should help in the campaign by sharing quality information to the general public.
Second dose of vaccine, please take the second dose of vaccine. I also want to reach out today to the fellow health workers. And I call them fellow health workers because I'm a pediatrician myself. And I've worked like you in the wards for many years. You are at the forefront of the risk. When COVID patient comes, you are the ones who are handling them first. You are the first responders. And all over the world, we have lost many people because of COVID. I would request health workers that you are in the priority group, please reach out and get yourself vaccinated. COVID vaccination is a very important part of the COVID response. And I can assure you that the safety of the vaccine outweighs the risk against the COVID disease itself. And lastly, I would like to acknowledge media. Media over the world has been very critical to support the immunization programs. And I would request you, we need your support at the most right now, to fill the space with positive information, the right information, and replace the wrong information with the right information.
I want to encourage all Nigerians to remain vigilant. Each and every one of us must follow social distancing, mask wearing, and curfew guidelines. Significant concerns remain about the threat posed by the coronavirus B16172 variant, also known as the Indian variant, which is observed to be highly contagious triple mutant strain of the coronavirus. In England, cases of the variant have doubled in 1 week alone. It is very important that we take all necessary precautions set out by the government to prevent an uncontrolled outbreak here in Nigeria. Vaccination remains the safest and most effective public health intervention known to man. Throughout history, vaccines have saved millions of lives. The federal government, under the leadership of His Excellency President Muhammadu Buhari, is determined to overcome the supply challenges the world is currently experiencing and ensuring that COVID-19 vaccines are accessible free of charge to all eligible Nigerians.
Zainab Ahmed, Voicetv, Nigeria.